Hey there, I'm Dr. Gary Driver, a fellowship-trained foot and ankle surgeon practicing in Fort Worth and Weatherford, Texas, providing care for the Dallas-Fort Worth area. Welcome to our overview of total ankle replacement surgery. In this video, we'll walk you through what happens during surgery, what recovery looks like, and what outcomes can be expected long-term and with mobility. The goal of total ankle replacement surgery is to restore motion, relieve pain, and help patients return to their daily activities with improved comfort and quality of life. The ankle is a hinge joint connected by three primary bones, the tibia, fibula, and talus. There are many ligaments and tendons surrounding the ankle joint, which can break down over time and have other effects around the ankle that can lead to decreased stability to the ankle, which can lead to deformities of the ankle. Osteoarthritis, rheumatoid arthritis, and post-traumatic arthritis can limit everyday activities secondary to pain and lack of motion of the ankle joint. Total ankle replacement, also called ankle arthroplasty, is a surgical procedure we perform for ankle arthritis. This consists of placing metal components on the tibia and the talus with a high-grade polyethylene spacer in between to help with range of motion. The design of the total ankle implant is meant to help mimic the natural range of motion of the ankle joint itself and restore mobility and range of motion for patients suffering from this disease. Typically, we reserve total ankle replacement surgery for patients that have failed conservative care. We normally start with injections, bracing, oral anti-inflammatories. Sometimes these don't provide long-term relief. Total ankle replacement and ankle fusion have been two procedures that have been around for decades. Over the past 10 to 20 years, ankle replacement surgery and the technology have advanced so much that total ankle replacement surgery could now be argued to be the gold standard. Ideal candidates for total ankle replacement typically have good bone quality and good foot structure overall. Over the past several years, total ankles have advanced so much that we can correct deformity with the ankle joint that will also correct deformity of the foot. Think of the foot as the foundation. If the foot has a significant deformity, placing a total ankle may not be a great surgical procedure. Oftentimes we recommend staging these, requiring surgical fixation of the foot and restoration of the foundation prior to replacing the ankle joint. But as the technology progresses, we will probably be able to do more and more when it comes to total ankle replacement. Ankle replacement has the ability to maintain the range of motion of the ankle, decreasing stress on other surrounding joints. Historically, we did ankle fusion, which provided great surgical outcomes, but long-term, other joints started to break down from lack of motion and they developed arthritis. A benefit of doing total ankle replacement in this scenario is taking stress off of those joints, often requiring those joints not to have any intervention. Let's talk about preoperative planning for this procedure for total ankle replacement. Typically, we come in before the procedure and go over the procedure in detail. I like to use patient-specific instrumentation that allows me to have a custom template for a patient's ankle for the cut guides. I like to show this with the patients so they can understand what's going to happen during the surgery and what their implants are going to look like. Preparing for the day of surgery, you want to fast at midnight. The night before, wash with an antibacterial soap. You will need non-weight-bearing equipment such as a walker, knee scooter, crutches, or a wheelchair. It often helps to have some type of ice machine or ice packs ready for icing and an elevation wedge or pillows so you can elevate your extremity. The surgery can be performed inpatient in a hospital setting or sometimes outpatient depending on other medical comorbidities. The day of surgery, anesthesia typically talks with you as a general anesthetic, and oftentimes they provide a regional nerve block, so when you wake up, there's no pain in the leg. It is very common with total ankle replacement surgery that you may wake up with a drain or an incisional wound vac that helps with incision healing. Total ankle replacement surgery typically lasts 1 to 2 hours for the procedure itself. Normally we use computer-generated models and custom patient-specific templates to help us during the procedure. These typically take about 4 to 6 weeks to make after a patient obtains a specific CT scan. The incision for the total ankle replacement is typically on the front of the ankle for primary procedures. The bone is resected with patient-specific templates, so we can perform these based off what the computer-generated report shows us to provide the best long-term outcome. We usually use trials during the procedure to ensure this is an adequate fit. Once we select the proper implant, we place this against the bone and tap this into place and often utilize cement. A high-grade polyethylene insert is used as the spacer to provide the range of motion of the ankle joint. While total ankle replacement surgery is considered safe, like many surgeries, there are complications that can occur. Incision healing is one of the more common ones. Nerve injury is a common complication as well. Infection can occur, and DVT and blood clots can occur. Typically, we mitigate these risks by placing patients on oral antibiotics, use an incisional wound vac on the front of the incision to prevent dehiscence, and elevate the extremity to prevent swelling that could lead to dehiscence. Let's talk about post-operative recovery. Typically, patients are placed into a splint for the first week after surgery. Oftentimes, I utilize a drain for the first couple days. This prevents hematoma from developing in the front of the ankle, which could lead to infection or wound complications. This also prevents the bone from trying to grow around the implant long term. Typically, the splint is left on for about a week. We have patients non-weight bearing during this time frame, elevating their extremity and icing behind their knee. At week 1, we come in and we remove the incisional wound vac and typically place a cast for a week or 2. We then return to the office at that point in time and remove the sutures. Still remaining non-weight bearing until about week 4, we can start range of motion and getting the extremity wet. At week 4, typically we start partial weight bearing and gradually increase this over 2 weeks utilizing a walker or some type of assistive device. At week 6, we can be full weight bearing in a boot and we reevaluate at that point in time with radiographs. If doing very well, we will likely transition back into a shoe and an ankle support and start physical therapy. Some tips for success during this procedure. Always work with your surgeon to determine a patient-specific guided plan for you. Typically, adhering to the non-weight bearing protocol and the protocol put together by your surgeon, you will have a good outcome. By month 3 or month 6, you should be feeling pretty good with your total ankle replacement. Typically, swelling and some nerve pains can still occur. This can last for many months, but gradually gets better on its own. The recovery can be a long process, but if you stay focused and patient, you will hopefully have a good outcome and be happy with the reward. Thanks for watching. I hope this can help you understand what total ankle replacement surgery can do for you. If you or anybody that you know has any questions about what we discussed today, please reach out to me at Texas Healthcare Bone and Joint Orthopedic Clinic.